Topic is interesting. Topic can create a lot of heat, and we've been discussing this ever since I think ISOD was formed. We've been given 40 minutes, and I have six distinguished faculty. So hopefully, without wasting time, let me go forward. If you look at the WHO guidelines, it clearly says organs should only be donated without monetary payment or reward. Purchasing or offering to purchase should be banned. Does not preclude reimbursing reasonable and verifiable expenses incurred by the donor. The Istanbul Declaration says the same thing, prohibits transplant commercialism, advises for self-sufficiency. If you look at the incentive spectrum, you start with recognition, non-financial incentives, reimbursement, donor insurance, direct payment. I think the first four are not so much of controversy. It is the direct payment which leads to all the problems. Just very briefly, in very simple language, if you look at the financial compensation and the ethics of it, if you define what is ethics, ethics is an emotional reaction to a situation which leads to action and behavior. So somebody feels there's an action, and then that leads to behavior, and this behavior may be acceptable to the society, culture, religion, and law. It may be acceptable to the individual, but it may not be acceptable to the society in large. So many ethical situations are there which crops up in transplantation, and financial incentives is one such situation. So for the recipient and the family, the ethics of buying a kidney may be right, but not for the society at large. So ethics is very individual driven, and it's only relative. It's not absolute. Remember that. And that's why all the arguments and discussion. This century's ethics, the question in this century is going to be not if we can do it, but should we be doing it? And that includes things like cloning and so on. If you look at transplant business overall, in 2022, we did over 157,000 organ transplants worldwide. India did over 17,000 transplants. Cost of transplants in India varies from 5 lakhs to 20 lakhs in a conservative kind of figure. And living donation is about safety of the donor, and disease donation is about the safety of and outcomes of recipients. But in both donor surgery, the beneficiary is the recipient of the organ. So without donation, there will be no transplants. The transplant business in India is about 17 billion rupees, if you estimate the figures of 17,000 transplants at that cost which I showed you. And all we expect the donor to not get any financial compensation. So the question is this fair, that the donor should not get any financial compensation? So how many people in the audience feel that it is not fair? Just raise your hands. How many people are not sure whether they should get a compensation or not? So most of you feel that it is fair that the donor doesn't get any compensation, despite the whole thing depending on the donor, right? Good. Okay. That makes my job easier and the panel's job easier. And in developing economies, we prohibit financial transactions, wish to promote commodification, exploitation. However, the inducement of various kinds have been discussed to improve the donation rate. Preference in jobs, education support for children, railway passes and others. I think these are all non-financial tools, and this can be encouraged. Yes? What is my panel feel? And Dr. Anil Kumar, I think NOTO also has some areas, and we'll discuss that as we go forward. But these are non-controversial. You agree to that?
Yes, if they can be supported with this, even the health insurance, if for the donor particularly, I think we are thinking of rather health insurance should be made mandatory for the living donor. And who is going to bear that expense? because if a living donor doesn't have a health insurance, because he needs to be followed up, he needs to be given treatment, and he has to receive, suppose the transplant goes on in a private hospital, and he has to follow up with his physician many times in a year, and
Sure.
who is going to pay for his follow-up treatment? So
Dr. Tiwari wants to say something. Dr. Tiwari, try and keep your answers short so we can take more questions.
Yes, sir. In case of the living, you can do the health insurance, but in case of the deceased donor transplant, the family member, the poor family,
That will come to
health
disease-
card.
We'll come to
So,
that. We'll come to
yeah,
that. in a-
health
in a
card
bit.
and health insurance, the family member also we have
We'll
to
come,
think
we'll
about.
come to that.
That
Dr. Kohli,
Okay, I think first of all, amongst this panel, except for Dr. Shroff, who is all in one, I wish all in one means surgeon, sociologist, psychologist, and everything. There is no sociologist in this thing. And in your introduction, you mentioned a lot of things about ethics. That is the acceptance by the society, ultimately, of a reaction, which should be within the frame of law as well as the society's framework. So we do not have any sociologist amongst the panel, and that
I would consider you the
since
sociologist,
You are all
Dr.
in one.
Kohli.
That's why I said we have a check point over there. Coming to the first, we'll talk about I think live. And rather than deceased, I'm trying to separate it out. I'm talking only about the live donation.
no, I just wanted you to comment on first this preference in jobs, education support, railway passes, and we'll come to all that as we go forward. Is this acceptable?
Obviously, I mean, there is no
Yeah, no
confusion
problem
about
here.
that. I think as far as not only incentive or anything, it is just like you mentioned, and then Dr. Gopal Krishnan mentioned, the honoring the family of the donor, not only deceased donor, of the funeral, etc., state, even just like the war veterans, which are honored everywhere, just like an organ donor, whether it's a living or a deceased, the family is honored, and otherwise the life donor is also honored, whether it is in the form of a job, whether it is in the form of other non-financial incentive. That should be done in totality. I mean, there's no confusion about that.
Thank you.
So
I'll come to all your points one by one. I have discussed it yesterday with you. And then things like honoring of donor families, priority in transplant waiting list, discount to health insurance, premiums, tax. Do we give priority to transplant waiting list, Dr. Anil Kumar, now?
in the, for the deceased donor family member?
Yes, no.
Yeah.
Yeah, disease donor, yeah.
Yeah,
for them.
if if we have a near relative
Yes.
of the previous deceased donor now requiring kidney transplant, then extra 5 marks are given.
Extra 5
So,
marks. are
so that is one incentive. So if it is for the near relative of the deceased donor.
given. Okay. Ashish, you want to say something?
I think that's a very valid point. Somebody who's donating kidney either of living or after death, they're contributing to the national kidney pool. So giving extra points is a very good idea, but 5 points are probably too less. At
Too
PJ,
less?
Yeah, at PJ we give 5 years of waiting period advantage to living donors. We've had one living donor who's been transplanted out of the list because of this priority. And first degree relations, we give 4 years of waiting period advantage. 4
Sandeep,
years.
you want to say something? And then I'll come to Arpita.
No, we can make a separate pool for the deceased donor panel, and that list will be the separate, and that will be more effective if we, for the allocation priority those group of the patient.
Sandeep?
Sir, I would say that these actually are simple decisions to take,
Yes.
because this one
Comparatively.
is particularly in our hand. This won't get opened up in the society a lot. And this is minimum we can do for a person
Minimum we can do.
who has actually donated organs for multiple organ transplants.
And you know, the Tamil Nadu, what Dr. Gopal Krishnan said yesterday, honoring the donor families, district collector going to their house to honor them, all this really has an impact. And families feel important, and as Dr. Kohli said, war veterans, the way we honor, it is something similar. We need to do that. We need to elevate the society's, moral also. By doing that, we also create a trust factor in the system. Dr. Arpita.
Yeah. So I missed the last question. I differ in the point that all living donation families should be honored. We really have minimal altruistic living donation, either the related living donation or we accept or not accept, there is a pool of unrelated
This
donation.
honoring is more for disease
And
donation.
yeah, that is the response to the last question,
Yeah.
that we honored the deceased donor families.
Yeah.
We should reach the villages and remote corners for honoring the families, because not always in the villages these people face questions great about their deed. They are also blamed because they have participated in selling organs. We have faced that, and we have reached the remote village and had talked with the panchayat authorities and all, and honored the person in front of them. So that has a meaning, that we should carry the honoring up to the remote level.
Yes.
And make others feel that this is a really
Very important.
Really, yeah. So this is one point. And what Sandeep said, that regarding the how much will be the waiting period before giving the priority,
Weightage.
how much will be the number given for priority, will be a matter of discussion, but it's
Yes,
totally in our
absolutely.
hand, and
I
we
agree.
all should agree.
I agree. What's Ashish? Anything urgent?
So while Dr. Arpita was talking, so just something came on my mind, that giving benefit in terms of jobs, would it lead to intentional organ donation?
So
like-
it's a coercion you're talking.
Yeah,
By
yeah,
trying
so
to
the-
give jobs, you're
Yes.
trying to give. So can you not have a criteria, let's say, where a breadwinner is gone, and I'm going to come to that in a minute, where a breadwinner is gone, he is brain dead, and the family wants to donate. In that situation, do you think giving a job or rehabilitating the family would be a good idea?
So I was actually talking about the living donation. So
No.
giving,
In that I was talking about the disease donation.
yeah, so disease we need to categorize. As you rightly said, that it cannot be a blanket thing, so we
Yeah.
possibly need to categorize it, yeah.
Okay. So waiving of hospital charges in case of disease donation, what is your opinion on that? And that happens very often in our hospitals.
So who will take up the question?
No, I'm asking waiving of, I'll start from Dr. Anil Kumar, since he's our head. You know, this in private hospitals, many times family will say that, you know, if you give us money, we'll donate. You know, because we can't pay the bills of the hospital. And many times waiving of charges comes to the private sector. What do you think?
It cannot be actually applied, I think, as a blanket this thing. But because if we waive off the charge, it could be an inducement
Coercion.
also.
Inducement,
Could
yeah.
Inducement also for the because the family that time is running out of finances, and if they say ki you just agree for donation, we will waive off your charges. So that kind of it cannot be blanket, but some kind of a without that subsidy, if can be, or it can be supported through some other mean, but at least as the law says, once the brainstem death has been declared, then the no question of billing to be continued after that.
of
That
course.
should be there. So
I want to ask the floor. No, please. I can't have questions. I can't have discussion because it's only 40 minutes. Just wait. How many of you, most of you are in private sector here, how many of you think that we should waive off charges in a case where the family is not able to afford? After brain death, no problem, waiving off charges. Hospital bill is 5 lakhs. Family says that if you waive off charges, we'll donate the organs. How many of you feel that we should go ahead? If you say yes or no, please raise your hand. Waive of charges or no charges? So quite a few says waive of charges. So
Sir,
again, the
I think
opinion
the
is
response
divided
should be
here.
Divided into NTURC as well as transplant.
It doesn't matter. NTURCs and non-NTURC, doesn't matter. Waiving of charges is what I'm talking
Waiving
about.
of charges of the patient should not be blanket.
Yes.
It should be person specific.
It should be?
It should be person specific. You can take in consideration a
So
person.
here I'm having a poor family whose breadwinner is brain dead, family willing to donate if hospital bill waives off, or family wants some compensation to take care of a family needs, education of a child, loan to be paid, etc. These are real situations. I'm not making it up. And this happens in private sector all the time.
Yeah, you can subsidize, but you should not go for that. Is also an inducement that.
So, many of them, here raise their hands of waiving of charges. And I believe me, in private sector, it happens all the time. Dr. Swanlata is here. I'm sure in Hyderabad, is she here? Yes, she's here. In Hyderabad, in Tamil Nadu, in Karnataka. I've heard this so many times. And we turn a blind eye, as administrators or whatever. But this is the reality of our country. Yes, Ashish.
So can we have a poll regarding how many of us believe that this is actually happening in the country in the private sector?
How many of you think that is actually happening, waiving of charges in the hospital? See, so many. And this is the way things are going forward, so accept it and put some kind of, regulation to it. Otherwise, then it comes up in media and all kinds of nonsense takes place,
But
and then the doctor is in the doghouse, Yes, Dr. Tiwari.
But if you are going to waiving the charge, the poor family are going to donate. So the other patients also admitted in the hospital, the poor, not donating. They
That's
also
true. Now you got a very good point.
Yeah.
So if you're going to waive of charges, it should be across.
Yes.
And that is very important. Otherwise, as some of you say, it's inducement to donate. And that's not right ethically. So then again, Government of India needs to come out with some policy in which it says that if a patient is not able to afford, you don't hold the body in the hospital. Otherwise, they don't even give the body back till the money is paid. I've seen that as well. And these are the practices happening now. So this requires a bigger kind of regulation to come into play.
I think a universal...
Dr. Kohli wants to say something. Yes, Dr. Kohli, tell me.
I'm just saying, if a patient is admitted in an ICU, and the amount of the charges which ICU have in any private hospital,
Yes, sir.
everybody will say, okay, we are willing to donate the organs, okay? And then what will happen? Do you think any hospital can run, 65% of the beds are ICU beds or HDU beds. So 65% of the money is gone. It will never ever happen.
But Dr. Kohli, the cost of ICU in India also is hyperinflated. Yes, Ashish, quick comments.
So if it is a universal waiving of charges, it becomes an honor. If we are being selectively, it becomes a coercion.
Yeah, I agree. I totally agree with that. Dr. Anil Kumar, do you think we can have some kind of a policy on this?
Yeah, because I agree ki if it has to be a waiving, then it has to be for all those who are poor. Like there should be some policy.
So can we put
it should not be used as a instrument to,
Do we all agree to that? It should be a policy that it should be waived off for every poor patient who is not affordable? Otherwise, don't admit the patient. Dr. Ray also wants to say something, but I can't take comments, Dr. Ray, because I have stopped that gentleman. But very, very quickly, only one sentence.
Yeah, in our hospital, like in Naran Health, we have a guest support cell. So there
How?
is
What, sorry?
Guest support cell. That's
Guest
for
support
patient
service.
support cell. So whoever, not for donation, if there is a problem, a poor patient at long time ICU and doesn't have money, he puts an application, it is considered. We also do the same thing for donation, though the donations are very minimal in Calcutta, but same thing applies. So it is not directly for donation, but if he is poor and applies,
So that's one tool as well.
applies, then we do waive up.
Thank you.
Yeah, there could be a system of, support from an external agency, not from the hospital, but
But if you are going to waive off charges for every poor patient, no external agency is going to support you forever.
nahi, for the organ donation cases,
Then again
like
you
there
are
could be some kind of
restricting your template to just, and then again it becomes inducement. So it needs to be, it's a very gray area.
Yeah,
and we
it's a
need
gray
to
area, no
have
doubt.
some kind of a policy from the top. Otherwise, as doctors, we are always in trouble. You do it, you're damned. You don't do it, you're damned. So that's the situation which we are faced
maybe
with.
some government agency supporting or some.
No, we always talk about some outer agency doing it and we just brush it off. And it never happens.
It should be a transparent and should be the government supported. That is the only thing. Otherwise, that
Absolutely.
exploitation will be there.
It needs to be given a serious thought. Ashish, quick comment, not very long.
It cannot be government supported, sir. Hospital level it has to be there, and hospital
level,
has to see how much is the average cost coming per donation, and that's how they are going to do. It's going to be charged to the recipients ultimately in the private sector.
Sandeep, you are in AIMS. Do you have problem?
Sir, ours is free for most of patients. So
Sorry?
our treatment is free for almost all the patients. So obviously we don't encounter this problem.
You don't encounter
There
any
can
problem.
be a way of cross-subsidizing things. One.
Yeah.
Or number two, a patient who is donating can have a subsidized cost. Instead of a private ward, charge him with a general ward, or a ICU, charge it with a general ward. So not entirely free, but heavily subsidized. That can be one way.
Dr. Shroff,
should be lying with the hospital.
if somebody says, okay, the cornea will be donated, so everything will be waived off, will that be the right thing?
What will be donated? Cornea.
Only cornea?
Yeah.
Then it's a very thing. And
Yeah,
we
yeah,
have
I
to
agree.
understand
Weightage.
the other mindset also.
Yeah, I agree. Weightage of the organ cost, if liver is donated, is more valuable than cornea. You're right. So these things need to be, the micro level things needs to be discussed. But on policy first, we need to be sure before we go forward.
So this decision may lie with the hospital authority.
Yeah.
That how far they can subsidize and for whom. It should not lie with the government
I
because the
agree.
private sector has its own
Problems.
own compulsions.
Okay.
So if I expect the private sectors to participate strongly,
Then-
I have to leave this in their decision area. And
That's one
till
way-
now, not the government sector. I have to remember the most of the donating centers are the private centers.
But almost 85%.
I think private is already doing it, so they'll be more than happy to do it. If we legalize it, they're already doing it, right? We had the response.
Yes, I agree.
No, Ashish, I don't feel from Kolkata experience that private is doing it. In Kolkata, still the donations mostly happen from the government sector, least participation in donation from the private sector. I think there are barriers for which they are not coming up.
So just to tell you that in Korea, they introduced this financial incentive for disease donation, and in the first year it increased, but subsequently it tapered off and had no impact. China also did something like that. Let's skip. US says that you can compensate donor for loss of wages. Do we do that in India? Are we allowed to do that, Dr. Anil Kumar?
Yes, that is allowed.
That's
Which is reasonably attributable to the donation which is happening. So that amount, suppose the person is going to be cannot do that work which he was doing for 3 months,
Yeah.
then that 3 months compensation that is allowed to be paid by the recipient.
Do you think we should allow it in India, compensation to a donor for loss of wages? I think these are all fair tools, easy tools we can incorporate without much issue. And reimbursement of payment for funeral expenses, again we allow in India. And Dr. Anil Kumar, how many people have utilized that funeral expenses?
Actually, this provision is there for a long time. We have some of SOTOs have now started taking this grant from us,
Yeah.
and we ourselves have also started implementing in Delhi and NCR. So it's very lately, but hope to that it will be
enlarge.
gradually.
It will enlarge.
Yeah. And some of the families they don't want also. That is also.
Yes.
right.
Sir, honoring actually would be a bigger thing.
Yes.
Giving 10,000 or 15,000 rupees just as a funeral cost is not going to really.
True. But sometimes we're a poor family, where, we've had the situation where we have had to put in the money to get the funeral done. Because they don't have anything. They are just on the road. They don't have an address. They are brain dead in a government hospital. What do you do with the body? So we've had situations where we have had to help them for funeral. So in that situation, definitely you're right. Some families don't want it. They don't need it, but some families can be given.
This
What else?
happened in the Goa, sir. We have noticed.
utilizing the money not
One by
only
one.
for funeral expenses,
Yeah.
but for the transport to the
Transport though
village
should be
cost.
free according to me,
Yeah.
to the house, to be honest. Yes, Dr. Tiwari?
We have noticed in the Goa also, the poor family used to take their funeral charges and they were happy. But they wanted to transport, they are from the other state. They wanted to transport the body to the other state.
That becomes problem.
And that also most probably going to induce that part.
In
That
Tamil
will
Nadu, we used to have one van dedicated for taking the body home.
Yeah.
And I think, Dr. Anil Kumar, do we still have that? One mortuary van or something used to take them home, or ambulance or something like that?
Leave alone brain death, any death happening in any hospital, totally free of charges. The mortal remains will be until the mortal remains reaches home.
Yes.
Any death,
Any death.
hospital in Tamil Nadu, across Tamil Nadu.
Thank you. And I also mentioned the full state honors to the donor family, which has really worked well in Tamil Nadu. Our waiting list is increasing. Dr. Anil Kumar yesterday said, you said 70,000 or 60,000 kidney transplants waiting, or 50?
Total is 70,000.
70,000 patients for waiting
Waiting
for
for
kidney
it's
transplant.
for all the organs.
For all organs.
Kidney, I'll have to check.
Kidney, I
now.
think you said about 50 odd thousand, if I remember right.
Yes,
from your
yes,
figure.
yes.
So huge waiting list, and in desperation, we have all these scandals happening from time to time. Currently, we have something going on in Rajasthan. These are all desperate measures from the families. So you buy or die. That's what it is. And in that desperation, people go and buy. Is there any role for regulated kidney sale? Since many measures have failed to curtail illegal trade, and many believe regulated car market could be a lesser of two evils. You can have strict guidelines, government can be a purchaser, fixed price, equitable distribution, close relatives can sell in case of deceased donor. So, Iran has done it, and since 1997, 1,400 people in Iran sell their kidneys. Government pays $1,200, no waiting list. So should we propose the regulated sale of kidneys in India? This is financial, non-financial, whether you like it or not, this needs to be spoken about. How many people feel that we can have a regulated kidney market in India? Raise your hands, please. I'm not going to take you tasks. You can raise your hands if you wish. Few only hands. So time has changed. This same poll, if we did about 20, 25 years back, many hands would have come up. And today, with the increasing disease donation numbers, I think people who feel sales should be there are in lesser majority than they used to be about 20 years back. Would you agree to that, Dr. Vijay Kher? Very quickly, because you have been around for a long time and you've seen it all.
But these scams happening very often, obviously, that the demand is very, very high. Unless
yes.
we have a very good disease donor program, which is very slowly growth in our country, especially in the north.
But I do see a change.
That's why this is.
Yeah.
I agree that selling of kidneys, like what you are suggesting here, may be a regulation. The regulations in India, so many things are regulated in India, but none of these are followed, and that's the problem. So we regulate many things, but there are many laws, but many of these are flouted.
Thank you.
Very.
Yes,
Agree with Dr. Vijay Kher, what he is telling is correct, sir. Because Iranian model also, there was organ trafficking, exploitation and those things. What is the experience we had? That will create the problem. So we have to increase the disease donor program, they have to promote.
Dr. Anil Kumar, one by one we'll take short answers, please. We need to have some view on this.
Actually, I don't think there is any scope of this sale of kidney being allowed. Though we have like issues like we have more of nuclear families now, we don't have those bigger families where you will find maybe we can expand the near relative further to include more relatives in that net, and but usually the other relatives, they are closely associated, are approved by the authorization committee. So, but sale of kidney, definitely it will be a disaster, and it has not helped in other countries also, wherever it was, like Iran, which was done, and moreover the deceased organ donation will come down drastically. It will impact the deceased program very adversely.
Ashish, if you are in a situation where this is the only option for your loved one, let's say if your family member, that there are no disease donors, buy or die, what did you do?
I think most will go for a buy option.
Buy option.
Yeah, but all said and done, then you can buy a kidney, but how will you buy a heart or a lung or
yes, sure. I'm really talking about kidney, that's right.
So we have other organs also, and yeah, that's it.
Sandeep, what did you do in that situation?
Sir, just two things. One, this obviously would be non-equitable distribution of the kidney. Those
no, I'm asking you, if you are in such a situation, what do you do? Because we always talk, things which really are not going to affect us. I'm saying put yourself in the situation and tell me honestly what will you do. And that's why I'm being a little provocative here.
Why not still have a life-related program if we are so convinced about our life donation? So if I am there, why not go for the life-related program?
Sorry?
If I am in that situation, why not go with the life-related option?
Yeah, life-related only. In life, we don't have a relation. Your blood group is different. There can't be a swap. They can't be ABO incompatible. The only choice is buy or die.
Sir, with ABO incompatibles now being accepted.
You don't want to answer that.
So relation has diabetes or hypertension. I mean, there can be so many situations.
Families, diabetes, hypertension becomes a problem.
Yeah. Anyway, Saripita?
Yeah, expand the living donation also. Many times I see those who buy they are not actually not capable of coming from family. They don't want the family donors to
No, I don't want anything. I want you to be in that situation. And you tell me what you do.
Sir, financial.
Basically, I should not go for buy, I should accept the alternative.
Right.
For
Dr.
kidney,
Kohli.
in fact, there is an alternative that my patient can wait on dialysis and even after 5 years can get a kidney.
Because
But
you're a
Ram and
nephrologist
Raj, but
and you know that.
Yeah.
Many patients say that if I don't get a dialysis, I'll die. And that's the real truth. And everybody, many of you will agree that. Dr. Kohli, what did you do?
I think you have already shown a couple of slides that since it is a problem, that's why the pockets keep on cropping up in different states of illegal or so-called kidney transplantation. That will happen. Of late, I think one change which I have seen, like for example, about this thing, that there is a lot of free dialysis or a subsidized dialysis facility all across.
Very true.
So now that thing has drastically changed. Like
True.
for example, earlier on, if we used to call 7 patients for a cadaveric transplant, all 7 will turn up. Now they wait. They ask you so many questions.
Right.
So that is an empowerment. That is one thing. And secondly, I think we in India the dowry was started so that the household runs smoothly. This will be a sort of an organ dowry, and which will keep on going on for this thing. That is not a solution.
But sir, we have enough data to say that the donors who accepted money and sold their kidney were not any better within
No,
5
that
years.
I'll come to later. I'm just asking you a question only to make it a little provocative. But funnily enough, there is also a situation where a patient from government sector whose dialysis is free of cost, who is very happy with dialysis, is called for having a transplant, who is on waiting list, and they refuse. They say, I'm happy with dialysis.
They are quite common with us, sir.
What it means is, if you have a good dialysis program which is subsidized, many of these patients would rather have dialysis than have a transplant. How many of you have had that situation? There are many. Exactly.
So that
So
is
what it
we are
requires
seeing-
is a well-supported Pradhan Mantri Yojana which wants dialysis in 738 districts of this country to be free. And if you do that, the pressure on transplant, living transplant will be a lot less. I can tell you that straight away.
In our center also some of the patients registered for deceased donor
They don't
transplant.
want.
They don't want. They want
don't
to
want.
take name out.
So
For
we
more
all
than
know
15
the
years on
realities.
dialysis.
Some people do relatively well in dialysis.
Yes.
also. We have to identify that population, and those may not be interested for.
They identify themselves now.
So this Iran model is being talked about by many people. And one of the donors said in Iran, they want it practically free. They think they are buying meat when they're buying a kidney. This was a potential organ donor. And there are many papers also coming out from Iran. Not many, a few at least. And Jargusi's papers say 76% of donors who donated for money would favor a ban of such donation. So as you said, Sandeep, it has never worked in anywhere, any institution. And this is a very famous paper of Madhav Goyal in JAMA. He did a survey in South India in a place called Villivakkam, which was used to be called Kidney Vakkam. It was in Chennai. And he made the same conclusion that policymakers and physicians should re-examine the use of financial incentive to increase the supply of organs for transplantation. So there are strong arguments against compensation. One question is, we ask this sometimes, to those very strong proponents who say that make kidney a commodity, including, I think it came from the Nobel Prize laureates as well at one stage, make kidney a commodity. So if you make it a commodity, what would be the cost of a kidney? If you equate kidney with, let's say, hemodialysis, what is the cost of kidney? We are talking about kidney here in India, give 40,000, 2 lakhs, 5 lakhs, 10 lakhs. Is that the actual worth of kidney? Or is it much more? And how do you have an instrument to calculate? Okay, tomorrow the government of India decides that we'll regulate the kidneys and we'll sell kidneys. So you need to put a price on it. Yes? So what is the price you think, Ashish, roughly?
Cost of an iPhone.
Cost of?
iPhone.
iPhone, yeah, that was gain, Absolutely, that's what is going on social media. Yeah. So anybody wants to guess the price of kidney?
It's a free economy. Once
Free economy.
this thing steps in.
So you think that-
you can't determine anything.
Let the buyer decide.
Yeah.
So
The buyer and the seller.
so we get this very often, even in our helpline. And if you take a normal span of a kidney for 10 years, let's say, and compare with hemodialysis, how much will work out? So 3 times a week, 4 times a year, 4 times a month and 52 weeks in a month will work out to about 5,700 odd hours, and it comes to about 28 lakhs. But kidneys work 24/7, and when you work out on that, it almost comes to about 4 crores. So if you want to put a price of kidney, put it at about 4.5 crores, and say, okay, go and sell. Let's see how many people are able to buy that kidney. So I'm just trying I'm not proposing anything, kindly don't misunderstand me, but if you want to put a right price to the kidney, this is the price you give to the kidney. And then you say commodify it. Market forces, free market, free economy, and this is the price of kidney. You buy it for about 5 crores, fine. I won't be very surprised if many of you guys in audience may be willing to do that. It's quite a lot of money. So let's go forward. Are there any other ideas for non-financial incentives like we discussed? We discussed the insurance, we discussed honoring donor families. Let's just explore some more non-financial. Yes, another 2 minutes, we'll finish. Thank you. Yes, Ashish, one by one.
I think one financial incentive.
Non-financial.
So financial, we have missed this.
We have finished.
No, financial incentives for people who are doing brain death certification. Right?
Yes, very important. That, Dr. Anil Kumar, do we give any money to the neurosurgeons and ICU guys? I think Maharashtra gives, Tamil Nadu gives? No? No. Maharashtra gives, Karnataka gives, I think.
Actually,
I don't know about Telangana, do you give? Swarnlata? For people who certify brain death, no, you don't give. But I know that ZTCC gives. ZTCC, nobody is here. Dr. Mule is here. Dr. Mule, do you give? He's not here? You give something, no? Oh, yeah. So, Dr. Anil Kumar.
Yeah, we started it on a pilot in Safdarjung Hospital for giving, I think, total of 30,000 whenever a donation happens, and it to be distributed among those who certify and those who come at odd hours and like that. But it did not help as such. Did not help. So
even I think 75,000 or 1 lakh is given by Maharashtra. Even Tamil Nadu gives some money to hospitals for taking care of the donor and so on. Those things are important. But I think that needs to be included in our policy. That some money should be given. They come out of hours to certify brain death. That may help.
Maybe that money was less. Yeah.
Travel costs in the odd hours coming. And honorary.
What about the Israeli people? In Israel, what they do is people who actually take a donor card, who place the organs, are given priority on the waiting list on deceased donor. Do you think we should do that, Dr. Anil Kumar? Simple instrument. If you are a donor, if you hold a donor card, you get a priority on deceased donation waiting list.
No, unless they will donate, how it can be? That will be.
Sorry?
If even they are going to pledge their family.
No, only if they donate, you're right. Yeah. So if they carry a donor card, in that situation, there's a priority given to the living donors of their first degree relatives of the family.
So it's basically you are saying that donor card is carried by one of the family members because somebody from the family has donated.
Some of them will get a priority on the disease donor waiting list.
Yeah. So that marks that I talked. That was one of the.
What are the suggestions?
That is already included in the allocation criteria of NOTO.
Right.
That to give 5 marks, but I agree that 5 marks is less.
Yeah.
And it needs to be increased. But it was decided by the experts who deliberated on that. So we'll definitely that should be there. But I would also like to say that this authorization committee approvals process needs to be more simplified. Some of these people, they become so investigative. Like if sometimes even among the near relative of the family, there is some kind of a money transaction is there, which is
we can't judge that what happens.
Yeah. So, but how it is happening under the table? But if at least somebody is known to that particular person, they should.
I totally agree that the procedure for authorization committee needs to be better defined. Yeah. You also give 42 days leave to in the government sector to the donors. I think, just for your information. Yes.
No, from other state, if you are giving the authorization committee, to establish the relation is very difficult because they are not having the birth certificate. Those who are more than 40 years, other state, UP, Bihar and other Madhya Pradesh, they are not having the birth certificate. So they used to bring any
Donor, you do a DNA and parental kind of tracing is possible.
But if you are not going to do that, it's simple. It's not a simple process to do the DNA. It's not simple process to perform the DNA test, the donor and the relative. That is
I
the
agree,
problem.
but it's not, now it is available, more easily available.
There is a Form 5 which is signed by the histocompatibility pathologist, which we take as a proof for parental relationship.
Do we have 2 more minutes or my time is over, welcome time is over?
Yeah. Yeah.
Dr. Deepak, some of you want to say something, but we don't have much time. We need to wrap up in 2 minutes and I need to give one.
There for half the time. So there is a donor, there is a kidney bank concept. Professor Danovich I had invited 3-4 years back. It is his concept. Basically, suppose a grandfather wants to donate to the grandchild, and the grandfather is getting old, but child has to stage 3, doesn't require a transplant now. So grandfather can donate to the general pool, and the donor will get, the recipient
These
will
are
get
good ideas.
Priority.
But
that is there in some of the states of
You know, Dr. Ray, the problem is in our country, in living donation, how to regulate it properly so that it is above board. We also have altruistic donors who truly are altruistic. I have a gynecologist sitting in Bangalore who wants to donate. But the instrument for donation in such situation is very difficult, whether it's actually altruistic or not altruistic, financial. That's why we're not able to do it. Otherwise, 5 to 10% of the waiting list can be taken care by altruistic donation in this country, believe me. I'm saying this because we are running a helpline and we know how many people actually genuinely call to say that we want to donate. So, but for that, it has to come from the government. We can't do it.
I think society can work towards that.
Non-directed donation.
Dhananjay, very quick.
Non-direct. Actually, altruistic can be allowed, but it can be allowed in the beginning only from those who are very rich. You know, those who have a income of non-directed. Basically, those who have a income of say around 2 lakh rupees at least in a month, those people may be allowed, not the poor people.
At least you can start somewhere.
It
could be 5 lakhs.
Somewhere. Yeah.
It could be 5 lakhs instead of 2 lakhs also.
Yeah.
Dhananjay, one sentence only you have.
So I'm working in the government sector from last 30
years. Dhananjay, you have only one sentence to say. Tell me what you want to say.
One sentence is that मरता क्या नहीं करता जान है तो जान है. So at least we have suggested some thing like शहीद का दर्जा दे दिया जाए, है ना. Second thing, there must be no if the government is ready to give the compensation, we should not oppose that thing.
We should not oppose it, okay?
At least we are thinking in Rajasthan that at least we should come up with the thing, and our society should not oppose those things if the government is ready to pay something.
So I agree. So any last thoughts? Finished? You want me to call it off? Yes? Thank you very much, panelists. I'm sorry, some of you may not have had an adequate kind of chance to express yourself, but I think this discussion will keep going on.
Yeah.
This is not the end of it. Correct, Bolo? Yes or no? Okay, good. Dr. Kohli, you want to say something? I know you wanted to say you had some social kind of angle ideas. If you can sum it up in 1 minute, it's great.
Okay, fine. I think whenever something has to succeed, a movement has to be created. A movement has to be created, then only it becomes successful. And for creating a movement, I think whatever for the deceased donor, the way the respect to the donor, the donor's family, rights, sort of a state funeral which is given to the highest judiciary, etc. And then further on, once that movement gets created, automatically things fall in place. I think for deceased donor, this is a very good movement which can be created.
Absolutely.
For live, it is a little complex.
And
I think I will say for the deceased, a movement should be created.
I agree. And this idea of, previously it used to say ki everything is in public domain, public nahi bolegi haan. At least now we've changed that, and we do agree that all the problems are in the hospitals. And my mantra now is create green corridors within the hospital. You don't need them on roads anymore. And that is what is required. A lot of processes to be put in place in hospitals to make disease donation possible. Because as transplant clinicians, do remember that ethics which will govern organ donation will be used as a template for the future of medicine, ethics of future of medicine. So we have a responsibility. So thank you very much, panelists. Thank you, audience. You have been a great audience. Thank you.